Here at home, getting a new job is exciting, but for recently hired community service nurses and doctors, that excitement is eclipsed by the pandemic. Barely a month into their training, and they've already had to deal with the second wave of COVID-19. For more on this, our reporter Nqobile Madladla joins us now from the Heidelberg Hospital. Nqobile, earlier on, when we spoke here on eNCA, one of the officials from the hospital was saying that there are lessons that they've learned in terms of what it is that they can get to serve the people in the community. What are they saying about the nurses who have just been employed? What are their struggles?
Well, Masejo, we are about to find out because luckily I'm joined by one of the nurses who had to experience the first wave and now she's experiencing the second wave. So, Nurse Cele, please will you just explain to us how it has been like to work on the first wave and how it's like now to work on the second wave?
Thank you. It's been, I'd say, hard and at the same time exciting because you learn from these experiences. You see different kind of signs, and that wave, some of the patient did not show with the same signs that other patients have now. So it's been hard, but at the same time exciting because it's where you see yourself. It's, you know, I've worked for today and I've helped so many people, so it's, yeah.
Obviously a traumatic time as well, also just as exciting.
Yes.
Perhaps explain to us, how have you dealt with patients that have needed your assistance on emergency basis?
I've done all my best. I would do as my doctor, that whatever he prescribed, I'll make sure that I do as he prescribed, and I'll do critical thinking at that time. You do whatever that will make a patient safe at that time. I won't say this is the way how you should do what treatment you should. You'd act according to the patient's presentations.
All right. Thank you very much. So, Doctor, also you've had to obviously deal with this, and I understand you're an intern. So you haven't even spent 2 months in the hospital. Tell us about the training that you've had to go through.
Well, yeah, it's kind of been like East and West, you know, because throughout medical school we didn't have a pandemic. This is like the first ever, you know. So we never worked in like PPE for 8 hours, you know, kind of like working in a sauna. But yeah, you know, but the skills that we were taught helped us a lot. We're able to adapt and help patients as possibly as we can, you know. But it's been kind of like emotionally grueling, you know, because these are people that we're dealing with. So it gets kind of difficult at times, but the support system from our colleagues, it helps a lot. It helps a lot, yeah.
So I'd imagine when you got a job, you were excited to come work, but were you nervous at all?
Yes, I was excited, but yes, the nerves were definitely there, but as we know, being in the health system or a health professional, most of the time is a calling, you know. So even if you're scared, you know that you are needed and you have to show up time and time again. Most of the time we miss our families, we can't see them as much as we can. Some of us have young kids, you know. But I guess it's the new normal, video calling, social distancing, only seeing them once every few months. So, yeah.
Lastly, you were telling us that you guys now have fans that just come to the hospital to see you. How have you dealt with that?
Well, it's not necessarily fans. I think like there's a lot of panic in society, you know. Maybe we could do better with patient education and stuff, because people would just show up at like 3 a.m. Complaining of just the body itching, you know. The hospital is basically the last place you want to be unless you need to be in the hospital. So like, yeah, we are dealing with a lot, but you do find those comical moments in the few hours, in the early hours of the morning sometimes, yeah.
Thank you very much, Doctor. Well, as you can hear there, Masego, they're saying that it's been quite an interesting time. Like he's saying, there's some comical times, but it is a time for South Africans also to understand that you need to stay at home and not be in a hospital, as the doctor's saying, unless you need to be here. But of course, just saying that their experience being here in the hospital has been interesting, working under the pandemic. As they say, that coming from school, there was no pandemic, but there is now, and so they have to deal with it as it comes.
Well, thank you very much. We'll have to leave it there. Nqobile Madladla coming to us live from the Heidelberg Hospital.